what do you do if you've decided you want to try to engage with my practice and either try to call the office and try to make an appointment, or see if a video visit is doable or not, or if you want to see whether or not you need to make a video visit consultation? There are two ways that you can come to quote unquote see us in the orthopedic practice. One is to call the office and speak to one of my teammates. The other is to go online and make a either in-person consultation or video visit just using the computer or your phone. When you are in a position where you'd prefer to just go online and make an appointment, you just can go to our website or you can use ZocDoc in order to go through the steps in order to figure out when you can see us. You can figure out whether you want to see us via video visit or come in for a consultation, whether you want to come to Midtown Manhattan or my Staten Island office. If you decide that you'd like to come in for an in-person consultation, you simply call our office if you want to speak to someone, and someone will pick up the phone and talk with you, and you can ask whatever questions you want. I don't expect my staff to be able to give you clinical information. That's not their purview, but they'll start asking you some questions about what's going on. So they'll want to find out what joint you're referring to. We handle most general orthopedics. Then they'll ask you what kind of health insurance you have, if any. And then they'll do a quick assessment, probably within 60 seconds, to ensure that we accept your insurance. And then they'll guide you through the process as to how soon you can come in to see us. We try to squeeze you in as soon as we can, depending on which office you're coming to, either Midtown Manhattan or Staten Island. And then you'll come in. And if you come in person for your consultation, you'll come to the reception area. You'll meet one of my staff. You'll either fill out some paperwork when you arrive, or you can fill out paperwork online prior to showing up. Then afterwards, you come into one of our examination rooms, and either I or one of my teammates will begin the process of taking care of you. The whole purpose of the first visit is not to discuss whether or not you need surgery. It's to figure out together what exactly is the diagnosis. And that's why you see an orthopedic surgeon, most importantly. Not do you need surgery or not. It's what exactly is going on. And we have a lot of experience in my practice in order to be able to determine that diagnosis. Oftentimes, we will give you a specific diagnosis on the first visit. I'm very proud of that. By us giving you the diagnosis in the first visit, we all have an understanding of what direction we want to go in. So first, we give the diagnosis. Then we'll discuss the treatment plan. Most of the time, in order to get better understanding of the details of the diagnosis for treatment, we'll suggest some type of imaging. X-ray, CAT scan, MRI scan, or a special type of MRI called an MR arthrogram. And depending on what the diagnosis is and who the patient is, we'll make that determination. Then we'll help you in that process of obtaining that imaging from preferred locations that we know and trust. Then after you get that imaging done, we're notified, and I or one of my teammates will contact you with the results. And we will sometimes talk to you over the phone about it, but sometimes we'll ask you to come in because we feel as though the conversation needs to be face-to-face. Sometimes it can be a video visit. So we try to mix the convenience for the patient with the level of seriousness that's involved. And then you'll come back to the office eventually, either in person or via video, and we'll discuss further treatment for you. The various treatment options that exist for orthopedic surgery include physical therapy, bracing, injections for pain relief, and sometimes surgery.